Welcome to This Explainer. Today, we're going to dive into one of the most fascinating and honestly, one of the most impactful tools human beings have ever come up with. When we think of health, we usually picture doctors, hospitals, maybe lab coats. But today, we are looking at the absolute ultimate scale of healing, and that is public health policy. It is literally the blueprint we use to engineer massive, systemic changes in society just to improve how well we all live. So think about this for a second. It's a pretty big question. How do you cure a disease without medicine? Like, how do you save a million lives without writing a single prescription? Well, the answer actually lies in the massive population-saving power of public health policy. I mean, think about seatbelts. Before safety belt laws were a thing, only about 11% of people actually wore them. But after laws and primary enforcement policies were passed, that usage rate skyrocketed to 90%. That is a staggering number of lives saved, not by a surgeon's scalpel, but literally by the stroke of a policymaker's pen. Okay, let's just jump right into our roadmap for today. We're going to cover the power of policy, the policymaking cycle, strategic tools for change, a really cool real-world case study on Swash Plus in Kenya, and finally, we'll look at Pestle in action. All right, kicking things off with Section 1, the power of policy, defining the blueprint. Now, to really get this, we've got to separate the actual concept of policy from all the noise of politics. So there's actually a very distinct difference here. Policy, at least according to the CDC, is a law, regulation, procedure, or administrative action of governments and institutions. These policy decisions are usually reflected in how we allocate resources, stuff like building safer roads or funding school nutrition programs. Politics, on the other hand, well, that's about power. It's the activity of governments and, frankly, it determines who gets what, when, and how. Now, in public health, professionals sometimes treat the whole political system like the third rail on a subway. They just want to avoid touching it so they don't get burned. But here is the critical takeaway. That third rail is exactly what gives power to the train. You see, achieving public health goals absolutely depends on sustained, constructive engagement between public health initiatives and political systems. Simply put, you cannot have effective policy without navigating the politics. So, how do we actually navigate it? How do you take a massive public health crisis and turn it into a working legal framework? That brings us to Section 2, the policymaking cycle, a structured approach. Let's walk through how this builds across the 5 core stages of creating health policy. First up, problem identification. This is where an issue graduates from just being a condition in society to an actual policy problem on a decision-maker's desk. You use data to prove, hey, a policy response is needed here. Step 2 is policy formulation. This is the design phase. What are our options? Are we doing a sugar tax, a smoking ban? We draft solutions and figure out if they're feasible. Step 3 is policy adoption, sometimes called legitimation, and this is that intensely political process of actually getting the policy approved. Think advocacy, lobbying, and a lot of negotiation. Step 4 is implementation. That's where government agencies issue the specific regulations and start enforcing the rules. And finally, Step 5, evaluation. Did it actually work? We measure the outcomes against those original goals and adjust if we need to. It's just a beautifully structured cycle that turns these big abstract ideas into real practical roadmaps. Of course, getting through all those stages, not always a walk in the park. You need the right instruments. So in Section 3, we're exploring strategic tools for change, mapping the battlefield. Think of these as the analytical weapons advocates use when they're in that formulation phase. Let's start with the problem tree. When you're analyzing a public health issue, imagine placing the central problem right in the middle. The branches up top, those represent the effects of the problem, and the roots down below represent the underlying causes, things like, say, weak budgeting or a lack of legal protections or just poor accountability. Now, once you map out those roots, you move to the objective tree. And this tool is brilliant. It takes every single negative you found in your problem tree and flips it into a positive desired outcome. So a problem like lack of teacher training becomes a clear objective like strengthen capacity building for teachers. It elegantly transforms this messy, complicated web of problems into a really positive, actionable hierarchy of goals. Okay, but once you have your objectives, you kind of need to check if they'll actually survive out in the real world. Enter the PESTLE analysis framework. PESTLE stands for political, economic, social, technological, legal, and environmental factors. Now, don't look at this as just some rigid academic homework assignment. Think of PESTLE as a 360-degree radar. By scanning these 6 areas, advocates can spot external threats, find opportunities, anticipate pushback, and even identify allies way before they launch their campaign. It just ensures your strategy is rock solid and actually fits the context. Now, it's one thing to talk about these frameworks in theory, but it is entirely another to see them save actual lives in practice. So for Section 4, let's dive into a real case study, Swash Plus in Kenya. What's totally fascinating here is the exact moment they made a massive strategic pivot. So Swash Plus stands for Sustaining and Scaling School WASH in Kenya. And WASH is just short for Water, Sanitation, and Hygiene. Initially, the team used a problem tree to figure out why school hygiene outcomes were so bad. And they realized, actually, scratch that, the root causes weren't just a lack of physical stuff, like missing toilets. The real roots were totally systemic: weak national budgeting, poor accountability, not enough teacher training. So by shifting over to an objective tree, they linked their activities directly to specific policy goals, like securing sustainable WASH financing in schools. Basically, they shifted their whole advocacy focus from just providing facilities on the ground to fixing the massive policy gaps all the way up at the national government level. But to pull off a national policy shift like that, the Swash Plus advocates had to understand the entire landscape, which brings us to Section 5, Pestle in Action, the 360-degree view. Let's see how they actually utilize that radar. This just brilliantly illustrates exactly what they were looking for. The SWACH Plus team really honed in on the P and the E of their analysis. Politically, they looked hard at the government's commitment to decentralization policies. Economically, they scrutinized the exact budget allocations for both education and WASH, at the national and the county levels. By doing this, they knew exactly where the money was supposed to be flowing and exactly where they had political leverage. And when you look at the full picture, you can see how comprehensive this really is. Socially, they looked at cultural attitudes toward hygiene. Technologically, they found gaps in monitoring tools. I mean, how do we even know for sure if a school has clean water? Legally, they reviewed the existing school health laws just to see what was already on the books. And environmentally, they had to factor in the harsh reality of water scarcity in certain Kenyan regions. By mapping out this entire framework, the advocates were able to tailor highly specific messages to totally different stakeholders. They knew exactly how to talk to the Ministry of Education versus local community leaders because they anticipated exactly what each group cared about. So what was the actual real-world results of using all these structured frameworks? A factor of 2. Through outcome mapping and incredibly targeted policy advocacy, the SWASH Plus program successfully led to the doubling of the national WASH budget for primary schools in Kenya. They literally doubled it. They didn't just build a few water stations. They permanently altered the resource allocation of an entire nation to protect the health of millions of kids. And honestly, that is the true, staggering power of effective public health policy. We've covered a ton of ground today, from the fundamental definitions of policy versus politics, all the way to seeing tools like the problem tree and pestle analysis actually secure national funding in Kenya. It really shows us that systemic change isn't magic, right? It is structured, it's strategic, and most importantly, it's achievable. So I want to leave you with this final thought. Take a look around you. What hidden root causes in your own community are just waiting for a policy solution? The tools to fix them are right here. Thank you so much for joining me for this explainer, and hey, keep looking for those roots.